Fusion Mobile, quality e-learning experience on the go.
Let's now discuss what exactly is circulating through the heart, okay, and that is the blood. Okay, the blood is a fluid tissue. All right, all other tissues we have discussed before now, they are, of course, they are solid tissues, but blood is one fluid tissue. All right, now it's made up of cells, of course, different types of blood cells, the red blood cells, the white blood cells, and the platelets, and then it has a fluid portion which is called the plasma. Now the plasma is the fluid portion of the blood. A better percentage of the blood is actually the plasma. It's okay. The plasma has about 90% water. Alright, we're going to be talking about plasma in details later, but simply put, blood is a liquid tissue consisting of cells and plasma. The cells and cell fragments make up the formed elements of the blood. Erythrocytes, also called red blood cells, are the most numerous of all the cells in the blood. They are disc-shaped or biconcave, and they are not nucleated when mature. When they are smaller, they have a nucleus, but as they grow later, as they grow older, they become not nucleated. They lose their nucleus. In an adult, they are produced in the bone marrows of bones, especially in the ribs, in the sternum, and in the vertebrae. Please take note of that. The red color of the blood is due to the presence of an iron-containing pigment called the hemoglobin, which helps in the transportation of oxygen around the body. Okay, hemoglobin is the oxygen-carrying component of the blood. Now, when the rate of the red blood cell is less, maybe due to blood loss, if somebody has an accident or has a cut and is bleeding so much, such that his blood level is low, we call such a condition anemia. Okay. Now, the other type of blood we mentioned is the white blood cells. White blood cells are also called leukocytes. Okay. Now, they are much less numerous than the erythrocytes, and they are amoeboid in shape. They actually have nucleus, unlike the red blood cells that do not have a nucleus. Now, there are about 5 different types of white blood cells. Leukocytes are into 5 different types. Okay. Now, I don't want you to cram it. Just use the mnemonic: no lady may eat beans. Where no, that's N, stands for neutrophils, L for lymphocytes, M for monocytes, E for eosinophils, and B for basophils. So these 5 cells make up the white blood cells. There are different types of white blood cells. Of course, we have the granulocytes and agranulocytes. You don't want to go into all those, but just remember that there are 5 different cells that make up the white blood cells, and these are as listed above. Alright, now specifically the neutrophils and monocytes are phagocytic in action. Okay, remember when we talked about phagocytosis, that is ability to engulf substances. So these neutrophils and monocytes are the ones that are responsible for those phagocytic abilities of the white blood cells, while the lymphocytes function in the production of antibodies. That's why we say the white blood cells are the soldiers of your body. You know, they are the ones that fight off infection and make sure you're healthy. Specifically, the lymphocytes are the ones that do this by producing antibodies. Okay. The eosinophils and the basophils, whose numbers are very low compared to the other cells we mentioned, are in the blood to play the role of combating diseases, just like all other blood cells. Generally, all white blood cells are known to help us combat diseases, but there are some others that have more specific roles. Like we said, those that have engulfing, where the mechanism by which they combat is by engulfing foreign substances, and those whose mechanism is by creating antibodies. Okay, and then we also should note that leukocytes are synthesized in the bone marrow, just the same way that red blood cells are synthesized in the bone marrow. Okay, now when a precursor cell is the original cell, as in the oldest cell, the cell that later becomes the adult cell. Okay, now when a precursor cell in the bone marrow becomes cancerous, the number of leukocyte cells become far greater than the normal, leading to a condition known as leukemia. Now, cancer is an abnormal growth of cells. Now, when cancer attacks the bone marrow cells, or the precursor cells now begin to divide in an abnormal manner. So it makes the white blood cells increase abnormally in number. Okay, the white blood cells have a normal count, there should be between 4,000 to 11,000 per millimeter cube of blood. But if the person has a cancer, such values are no longer feasible. Instead, what you're now going to be having is a very much exaggerated. You can even have as much as 400,000, okay, instead of the normal count of about 11,000 maximum. That's what we're talking about here. Now, the last type of cells we want to talk about are the platelets. The last type of blood cells are the platelets. They are cells, fragments produced by large cells in the bone marrow. They are also known as thrombocytes, okay? Red blood cells are also called erythrocytes. White blood cells are also called leukocytes, while platelets are also called thrombocytes. Now, the platelets are disc-shaped and much smaller than the erythrocytes, and they are much less numerous. That means their number is very few compared to the red blood cell. So in the cell, the red blood cell has the highest count, okay, followed by the platelets. The platelet count is about 150 to 400,000 in number, followed by the white blood cell. The white blood cell count is about 4,000 to 11,000. Okay. Now, the next we want to talk about is the importance of the platelets. Well, we're not going to talk about platelets function in details, but you should know very much importantly that it is the platelets that are responsible for blood clotting. If you have a problem with your platelets, your blood will not clot. Okay, and what that means is, now the problem can be with the platelet can malfunction such that blood clots too easily, or blood doesn't clot at all. Now, if your blood doesn't clot at all, you'll be having bleeding problems. Okay, even you have a small cut and you bleed for a long time. The reason why you have a cut and then you don't bleed to death is that the blood has a clotting property. It has platelets that helps your blood to clot so that the wound is healed. It forms a crust, as you can see. But if you do not have platelets, you will bleed to death. And then if you have too many platelets or your platelets are not functioning properly, your blood will be clotting inside your vessels. And that's very dangerous, because if it clots, it can block the blood vessel and blood cannot flow freely through that vessel. So it is very important that the platelets perform their clotting properties effectively as planned, as regulated by the body. Now, the next one to talk about is plasma. We said the plasma is the fluid portion of blood. Plasma is the liquid part of the blood. Okay, if you divide the blood into different parts, you have the cell part, you have the plasma part. If you remove the cells, what you have left in the blood is plasma. Now, it is straw-colored, in which is a straw-colored fluid in which blood cells are suspended. The major component of the plasma is water, in which are dissolved glucose, amino acid, waste products of cell metabolism, hormones, vitamins, fat droplets. All these things are seen in the plasma. But about above 90% of the plasma is actually water. Now, 7% of plasma consists of the plasma proteins like fibrinogen, albumins, and globulins. Alright, so the next one I'm going to talk about is lymph. Lymph is the water and dissolved substances that diffuse from blood capillaries to bathe the tissues of the body as a result of blood pressure and osmotic pressure of the tissues. When the heart pumps out blood in high pressure, the water that it gives off to bathe your tissues are called lymph. Now, living cells absorb food and oxygen from plasma, and their waste products diffuse into the plasma. Okay, the lymph is carried away by special vessels called lymphatic vessels. Lymphatic vessels also look like veins or arteries, but they are specifically made for carrying the lymph.
Fusion Mobile, quality e-learning experience on the go.